4 innovative solutions that promote sexual reproductive health and mental health have been awarded $10,000 cash prize each by Imbuto Foundation in partnership with the Ministry of Youth and Culture. One of the winners is Josianne Umurerwa from the Mizero Care Organization behind the Vuga Ucyire hotline project that aims at facilitating access to mental health information and service delivery through counseling sessions and campaigns to promote mental health. And in studio today, Josianne joins us to speak more about this. Good evening, Josianne.
Good evening.
Thank you for joining us.
Thank you too.
First of all, congratulations, and could you tell us about your project and what was the inspiration behind this?
Well, thank you so much. Most people get inspired when things are going well, but for me it's totally different. I was inspired by the problem that we have in our country. The fact that we're living in a country faced 1994 genocide against Tutsi, we have a high number of people with mental health problems, and the COVID-19 accelerated it. So we are bringing Vuga Ucyire hotline as a solution because it's a digital healthcare platform that is addressing mental health problems by providing online therapy session, which was to be done with the confidentiality in a safe space.
How does it work?
Well, we're going to reach to our client through the following channels. We have phone calls, we have USSD app, and we have mobile application. So we're going to reach to people through 4 stages. We're going to have a registration. Like when you access our app, we're going to have a registration. We're going to make a profile of our customer. We have appointment book for the patient who is going for physical session, multiple session, or group session. And we have consultation where our patient is going to be consulted, and we have post-consultation where our psychiatrist is going to give medicine to our patient.
Okay, you mentioned that one of your inspirations was the history of our country.
Yes.
So your target audience, is it just the victims or the people that have faced trauma from the 1994 genocide against the Tutsi, or anyone can access this helpline? Well,
we are targeting 3 categories of customers. So we have a youth who were born after genocide, we have a youth whose parents are perpetrators, and we have a youth with disabilities and chronic diseases that was caused by the history of our country and also COVID effect. Yes.
Okay, and is this free of charge? Are you charging for it? What's the criteria?
Well, we have what we call in psychology, we have what we call session, and session is between 45 minutes up to 1 hour. So one session is 10,000. So there is this cost released by MOH, but we are going as a Mizero Care Organization we are not allowed to go below, but we can go above or whatever. So we're going to have to make awareness so that our patients are going to be supported by insurance in a consultation, but for session, you have to pay it by yourself. Okay. But we're going to work with a different institution like National Collection Centers, Imbuto Foundation, FAGE, CNLG, with their beneficiaries, and to work with the different clinical hospitals who has a patient with mental health problems.
What's been the impact so far since the project began? Is it a new project, or is it something that started way back? And is there any impact that you've realized so far?
Well, thank you so much for a good question. Our project is not new to the market because in 2017 we were awarded by His Excellency Jeannette Kagame in Sigwa Award. So where we helped 500 youth to overcome the problem from their history, the problem of depressions, PTSD, and different kind of mental health problems. Okay,
Josianne, before I let you go, maybe what does the future look like for you and your colleagues and partners behind this hotline?
Well, first of all, we have a dream, like we want to have a therapy center. We're going to help a lot of people, and before I leave, I'd like to inform or emphasize my fellow youth that they have to put up their socks and to do what they love. Because before, it was my dream. I wanted to be a therapist, but by now I'm living my dream. And I was this kind of person who didn't believe in competition. I say it belongs to this person, to that person, but I want to tell you that it belongs to nobody. It can be yours as it was mine.
Absolutely. Thank you so much, Josianne, and well done on all the work that you're doing.
Thank you so much.
Thank you.